Hello. Have you ever stopped to think that there is a sneaky, often silent type of cancer that may be affecting even younger people? Perhaps you know someone who has experienced it or are even concerned about your own health. Today, we are going to uncover 7 signs that your body may be giving off and that deserve your full attention. When we talk about a silent enemy, pancreatic cancer, most cancers give us a few warnings, a few signs here and there. But pancreatic cancer is different. It acts in the shadows, often quietly, until it's too late. But calm down. There are clues, early signs that can make all the difference. I've prepared 7 important signs for you to know. And remember, information is power. It's the first step towards taking care of your health and the health of those you love. Before we continue this very important conversation, tell me in the comments, have you ever heard of pancreatic cancer being difficult to detect? Your experience or opinion is very important to our community. And of course, if you care about your health and want to stay up to date with more tips like this video and subscribe to the channel. That way you won't miss any new content and you'll help our work reach more people. Sign number 1. Jaundice, the yellowing that warns. When we think of jaundice, we often think of newborn babies. But did you know that it can be an important warning sign, even for pancreatic cancer? Jaundice occurs when bilirubin, a yellowish substance found in bile, accumulates in the blood, giving the skin and eyes a yellowish color. In the case of pancreatic cancer, a tumor can block the flow of bile from the pancreas to the small intestine. This causes a traffic jam of bilirubin in the blood. Watch out. Other symptoms can accompany jaundice, such as abdominal pain, clear clay-colored stools, and loss of appetite. Ignoring jaundice can lead to serious complications, such as severe itching, fluid retention, and even neurological problems. So, at the slightest sign of yellowing, see a doctor immediately. Early detection can change the course of history. Sign number 2. Unexplained. Weight loss. The worrying scale. Losing weight without changing your diet or exercise routine may seem like a dream to some, but it can be an important warning sign for various health conditions, including pancreatic cancer. When pancreatic cancer develops, it can interfere with the body's ability to absorb nutrients properly, leading to malnutrition and, consequently, weight loss. In addition, the tumor itself can release substances that cause the body to break down muscle mass and fat for energy. This weight loss is not that subtle change, but rather a significant decrease for no apparent reason. If you or someone you know is losing weight inexplicably, don't hesitate to see a doctor for a full assessment. Sign number 3. Blood clots. The danger in your veins. Blood clots are a serious condition that can occur in the lungs, heart, or brain, putting your life at risk. And believe me, pancreatic cancer is among the types of cancer that can increase the risk of these clots forming. This is because cancer cells can spread to other parts of the body and block blood flow. In the specific case of the pancreas, tumors can release substances that make the blood more prone to clotting. For younger people, this sign can be even more worrying, as they may not show other typical symptoms of the disease. Look out for signs such as sudden shortness of breath, swelling in the legs or arms, and an unexplained rise in blood pressure. When faced with these symptoms, seeking medical help is urgent. Sign number 4. Sudden onset diabetes. The uncontrolled sugar. Diabetes is a condition that affects the way the body regulates blood sugar levels. Although it is commonly associated with poor eating habits and a sedentary lifestyle, did you know that the sudden onset of diabetes, especially in people with no family history or other risk factors, can be a warning sign for pancreatic cancer? The pancreas is the organ responsible for producing insulin, the hormone that helps regulate blood sugar. When something interferes with the functioning of the pancreas, such as a tumor, insulin production can be compromised, leading to diabetes. Symptoms such as excessive thirst, increased urinary frequency, and high blood glucose levels can arise. It is crucial to understand that not everyone with diabetes has pancreatic cancer, but the sudden appearance of the condition, especially in young people without risk factors, merits further medical investigation. Sign number 5. Vague and persistent symptoms. The feeling that won't go away. One of the biggest difficulties in diagnosing pancreatic cancer early is that its first signs can be vague and nonspecific, easily confused with other, less serious conditions. Symptoms such as persistent abdominal discomfort, bloating, nausea, and loss of appetite can have various causes. However, when these symptoms are persistent and unusual for you, they should not be ignored. Delaying seeking medical help or an incorrect diagnosis can delay treatment. Be aware of any unusual and persistent changes in your digestive system and do not hesitate to go to a health professional for an assessment. Sign number 6. Changes in bowel rhythm. The bowel on alert. Changes in bowel function, such as frequent diarrhea, constipation, or changes in stool consistency, can be indirect signs of pancreatic problems. Although these changes can have many causes, when accompanied by the other signs we've mentioned, they can raise a suspicion. The pancreas plays an important role in digestion, releasing enzymes that help break down food. A tumor can interfere with this function, leading to these intestinal changes. If you notice persistent changes in your bowel pattern, especially if combined with other symptoms, talk to your doctor. Sign number 7. Abdominal or back pain. The persistent discomfort. Vague abdominal pain or back pain that doesn't improve with conventional treatments can be signs of a tumor in the pancreas pressing on nearby organs or nerves. This pain can vary in intensity and location and is sometimes stronger after meals. It is often described as a deep, nagging pain. If you are experiencing persistent and unexplained abdominal or back pain, don't ignore this sign. Seek medical attention to identify the cause. Cancer is a scary word, and uncertainty can generate even more anxiety. But remember, knowledge is our greatest weapon in the fight against any disease. By knowing these early signs of pancreatic cancer, you become more aware of your body and can seek medical help sooner, increasing the chances of an early diagnosis and more effective treatment. If this information was useful to you, please like this video. It's very important for this content to reach more people. Share this video with your friends and family, as this information could make a difference to someone's life. Subscribe to the channel so you don't miss out on more health and wellness tips. And tell me in the comments which of these signs surprised you the most. Your feedback is very important. It's important to remember that these signs can have many other, less serious causes. This video is intended to inform and warn, and in no way replaces a medical consultation. If you experience any of these symptoms, see a doctor for an accurate diagnosis and an appropriate treatment plan. Do you want to continue learning about how to take care of your health naturally? Watch our videos on how to clean your liver in just 3 days and 8 foods with more protein than 1 egg. Thank you so much for sticking with me to the end. May God bless us with health and life. Let's work together to promote everyone's well-being. Subscribe for more health videos.